Thank you. So, thank you very much, Daktari, for reminding us to start with a word of prayer. And as I want to, now that we are all in, first of all, as I said, Grandi is a medical doctor with Hennepin County Hospital here in Minneapolis, and he's also an assistant professor at the University of Minnesota. Dr. Edwin Bogongo is a medical doctor, has an MBA from Carleton School of Management, and a medical degree from Nairobi University. Currently, he's a physician and director in Alina Hospital and a chief medical officer for diaspora care. Ellen Kasadi is a church dialysis nurse at Fresnius Kidney Care and Honor of Reason Home Care. And she holds a master's degree in nursing from Grand Canyon University and a bachelor's in nursing from University of Minnesota. Lina Nyamwaya is a registered nurse and works as a nurse in a trauma hospital, holds a Bachelor of Nursing degree from Meadow State University, and currently a graduate student. Also is the president of Nurses Network, executive director of Bold Impact Group. Gerard Ondimu works as a capital markets loan administration manager in one of the banks here in Minneapolis, in the corporate office. Holds a doctor of business administration degree in economics. And we have David Vijanga, a graduate of Carleton School of Management and a sales agent with Remax. I don't know if we have left anybody out. I think, okay, Pastor Lee Kinyaberi, I don't know if he's in. He's the one going to talk about ministry, the impact with ministry, but he's a pastor of
yes, I'm in.
Central SDA, Central State, United Central SDA Church and Mount of Experience. So I want to welcome both of you in. And just something small. Yeah, that's a very good idea. Now, the question I want to ask, do you think the government has done its best? And that's why I wanted, you see now, like in Minnesota, we have 578 deaths. And out of that 578, 464 are from long-term care or assisted living. I mean, you've talked about that. Now, this is the flattening the curve. The question I'm asking, do you think the government like the state of Minnesota or United States has done the best? Because according to the module for CDC, if there is uncontrolled transmission, it sparks quickly and then it goes over the healthcare capacity. So like the measures we were putting about social distance and other things to flatten the curve, do you think, in your opinion, the government did its best to flatten the curve just to move it forward? Helen, you have something to say?
I don't think, I'm not a politician, but I believe that I don't think they did enough. I think by the time they realize, by the time they realize we try to do something, because I can give you an example. When I look at this study in China, when the Chinese people go to take care of this, they were equipped, which means
that something wrong with your microphone.
Oh, it is? Okay, let me check. Maybe am I mute? I'm not mute.
No. I mean, now we can hear you.
Okay, so I was saying that I believe that they didn't do enough, based on what I'm seeing. Because when I look at the news, like I know the same media is showing things, but we can see when the Chinese people in Europe, when they were going, those nurses that were going, or medical care personnel that were going to take care of the people that they were sick, they were very well equipped. For us here in America, like the first time I went to take care of a coronavirus patient, I was afraid. Okay. Because whatever equipment they gave me, I felt like it was not good enough. Okay. I only had a mask, and then they asked me to go to test for the N95, which is I failed, and then later on they gave me something else. So I felt like the equipment they gave me to go inside the patient room, it was not, I went to with my own clothes, my own uniform. But when I look at the other country when they were doing, they were like wearing some kind of suit on top of their own clothes. So, and then when I try to ask the charge nurse or the supervisor, say, okay, what's going on? I'm going to this way. Oh no, your clothes are not. It doesn't matter. You just before you go home, just make sure you take off your clothes in the garage. What happens if I don't have a garage car, a garage house? I have to go inside my house with my clothes that I took care of. So I felt like, what, we did not have the hospital, or our hospital, our government did not have enough. They did not do enough to protect us. That's what I felt.
Thank you. Do you want to talk about if the government has done enough, or to suggest what the government needs to do?
I'll add on that.
Yeah.
Mostly, can I go?
Hello.
Yes.
Yeah.
So
Yeah.
what I would say is, while we are looking at what the government is doing and what the government cannot do, I think it's good to redirect this to our own selves and reflect on this, and then focus on how we can assist our own people. This hour is very critical. The government is big, gigantic. We know there are failures. Obviously, it's not doing enough, but I would suggest that if we look at how it's impacting us and how can we kind of mitigate on these impacts. And honestly, the economic damage from this is huge. The RE estimates are predicted that the virus as it has now, it's going to impact 2.4% of the GDP of the world economy. And the world economy is $86 trillion. And putting that in perspective, we're going to lose so much money. But what does these numbers mean to our kitchen tables, to the people we support, to the people who depend on us? Those are the questions I'll ask you that we focus on. What can we do to reduce this impact, the medical impacts, healthcare, to ourselves, not the people we are supporting now, not the people who are fighting. Those who are fighting, those are us.
Okay.
And there are people who are depending on us. And we have so many people riding up behind us. With Oh, okay.
So maybe.
Yeah, Dr. Grant, you wanted to say something?
I could say one word also about what if the government has done much to mitigate and flatten the curve. I can say at the moment, yeah, the government has done something, but it may have been too late. I personally, my pastor, Vicky called me and told me, there's this coronavirus which is coming. I actually dismissed him and told him, you know what, that's not my concern now. I think there are so many other issues we must, first of all, consider or address rather than the coronavirus. So until I started seeing it coming slowly. So it may have been.
Reduce. Mute, please.
So,
someone mute.
The government, as it is now, when they started doing the lockdown and closing the shops and the schools and everything, it may have been a bit late. So we can learn that from other countries. The other countries which have done very well. Countries like Taiwan, Germany, New Zealand, who started doing theirs very early before cases were spreading. So the government has done something, but I think it came in a bit too late when we had so many people in the community already incubating the virus, and then they are now spreading it. Okay. So that is what I can say. And there was a lot of myths about this disease again, from especially in our community, that from the colored people saying it doesn't affect blacks. That led to people not observing social distancing, wearing gloves or the PPEs we were given in or masks given in the hospitals or in the places we work. So that is something which I can say it's also in our inherent as we have been brought up, which we need to learn as people of color, that there are things which we must learn quickly and join the rest of the group in observing social distancing and also wearing masks. And also, if we have been told, don't go out, please, we are there. So that's what I can comment.
Thank you very much. And on the same note,
Yeah. So
oh, okay.
yeah, let me just add. So I think there are two perspectives here: the dynamic of state versus national. So the Trump administration, I think, downplayed the coronavirus, and unfortunately, states like Washington and New York, because they are very deeply populated, they have very large Asian populations, exploded in terms of the numbers. And I agree that the reaction was a little too late. Now, what people don't realize is that even as the government was trying to create access to supplies for PPEs and all the other equipment that we need to be prepared, the states were not able to access those equipment because the state would buy from a supplier, the supplier would be given a higher price by the federal government.
Mm-hmm.
And so a lot of states had delays in obtaining their PPEs. Now, at my role at my health system, I have been at the front line of planning for coronavirus, and I can tell you this: we have done a much better job as a state in Minnesota. For example, every single day, we have all the hospital leaders across the state and people from the Department of Health have a conference call to go through a framework of preparation. We have prepared for the worst case scenario. From the standpoint of how many people we have, what expertise we have for people who might get intubated. Right now, our capacity for COVID-19 is probably not even less than 20% of what we have prepared for. Having said that, I think Minnesota, we're very fortunate that we were a little bit more radical in trying to make sure people stay away from work. Our social distancing efforts have paid off. If we look at our current model as of Friday, as of this past Friday, we went from thinking that our surge of patients was going to come in May, and now the models are even predicting as late as August for when we will see a spike in patients. I think in terms of flattening the curve, I would say I'll give very low marks to the central government, but I'll give very high marks to not only our state government here in Minnesota, but also the medical community across the state.
Thank you very much. Now, one of the areas where our community is very much impacted is the housing market. And I would like David Bichang. There is a lot of anxiety. People are thinking we are on a recession. House values are going to go down. People are losing jobs. Can you tell us the status of the housing market? Mr. Bichanga. Oh. Mr. Bichanga, is he muted?
He's muted.
Okay, let me see. Oh.
Do you want to remove the sharing of your projector so we can see where he's at?
Yeah.
If you remove the
Okay.
sharing of what you are sharing.
Okay, let me remove that. Stop sharing. Okay, David Bichanga, let me see. I will said everybody because I don't know how he entered.
David Bichanga is there, but he's muted. I can see him.
Okay. Can you hear me now?
I have unmuted everybody. Sorry. Okay,
Hi,
David.
everybody.
Yeah.
Hello.
Yeah, we can hear you.
Okay, so I just want to address the housing market. I know I get questions from people want to buy and people want to sell. And this is not like the recession we had in 2008, which was driven by the housing market or housing industry. in these are public health crisis. It's not a housing crisis. And we had a shortage of houses at the beginning of the crisis, and we are still having shortage of homes for sale. So I don't think that, I saw the other day Mark Cuban saying that the houses are going to reduce in value by 30%, and that assumption is not data driven. The difference between what we are seeing now and what we saw in 2008 is that back then, the reason why people were backing off their houses, they had no equity. Over the last 10 years, the people have been buying houses, have a ton of equity in their homes, and they're not going to walk away and leave their equity in the houses. Plus, in the last 10 years, banks, before they give somebody a loan, they have to make sure that these people are going to do what? Be able to make their mortgage payment, which means they have steady jobs. It's not like back then whereby anything that can breathe can get a mortgage. So speaking from what I'm seeing in the market today, housing market, if somebody told you that house prices are going to drop, they're probably lying, but I stand to be surprised. But so far, from what I'm seeing, I don't think that the housing markets or prices are going to be affected. We still have an imbalance, which means we have more people looking to buy homes than are willing to sell. And that's going to be the case for the foreseeable future. Okay. So if you want to buy houses, I think you buy a house because you need a house. You don't buy a house because you think the value is going to go up or drop. So people should, want to buy a house, buy a house. If you want to sell a house, you sell the house now.
Thank you. Anybody want to comment on that? Anybody with a comment on that or a question?
Yeah. Actually, I work in the capital markets, and there is a lot of appetite by investors to invest in home loans. So those who are willing to buy, there is a lot of liquidity in the market. And like my friend has just said, the fundamentals of the economy are good. Although we do not know the impact of COVID-19, this was and is still a temporary hike on the economy. For those who are willing to buy homes for investment, is different. But if you are buying a home for primary residence, I think it's the best time to continue buying. For investment, with due respect to my friend, I think for investment, I'll ask them to hold back a little bit because they need that money in the event this economy doesn't wake up and start running as soon as we expect it to run. And I was going to say in the future that even for those of us who are capital investing in elsewhere, especially in our country, Kenya, this will go slow. This will go slow and make sure that they have enough that can sustain them for the next 6 months or 7 months, not to be investing when they aren't very sure about the future. Especially when 75% of our people are actually working in the healthcare. We thought that they are very secure jobs. What I've come to realize is even those jobs right now are the people whom they are taking care of, nursing homes, they're dying, meaning that their source of income is also kind of dimming out. It's very important that they get to know the bigger picture before they start spending money on unnecessaries, including capital investment. I think it's very critical that people should go slow. People should just invest in themselves first and keep some eggs in the nest before they start spending money. Otherwise, they should buy primary residences.
Thank you very much, Dr. Ndimo, for that comment. Also, one of the areas we have been impacted most is because of this social distancing. The ministry, Pastor Nyaberi, I don't know how he came in, so I don't know if he's unmute. So some could enter with a phone here, so I don't know. Okay, Nyaberi, Pastor Nyaberi, can you hear us? I don't know.
Yes,
okay.
I can hear you.
Yeah, can you talk about the impact of COVID-19 on the ministry?
Yeah, thank you so much for bringing up this thing. I had COVID-19. Let me start by stating that as Dr. Karandi mentioned, I had been studying this thing when it started in China because I had a relative there. And I wanted my church to be prepared. And I wanted, when I called the conference, they were totally unprepared. And when I called Dr. Grandi, he dismissed me. he said this thing will go away. But we were fairly, because of perhaps my insistence, we were fairly prepared as a church. But even then, we have had a number of our members who work in the healthcare get infected. But having said that, allow me to mention some of the challenges. Challenges that have been there is, you know, this thing just came, and we were told in one go that no more congregating. So the greatest impact was, how do we disseminate the message to the members while they are at home? Because I was prepared, my church was prepared, we were able to set aside earlier on about $3,000 to buy equipment. You can imagine smaller churches who didn't have that kind of fund, how they struggled at the beginning. But as of now, many churches that I have checked with have caught up with technology. They are using Facebook Live, they are using YouTube, they are using Zoom, and at least programs are running. Another impact that we were fearing that has not shown, because at the beginning we feared that the offerings and the tithes will go down. But the figures we are having, and I have checked with many of my colleague pastors, are that the figures have really not gone down. If I can testify even from my church, we are what we used to be last year, the same month, look at it now, is the same thing. So nothing has been affected in terms of giving in that regard. One area that has been affected is inability to follow the calendar of events. You know, as a church, you plan the whole year. You plan when to have the African camp meeting, when to have evangelistic meetings, when to do infrastructural development. All those are grounded. So there's nothing happening. Only the pastor goes to church or from the house gets to preach. And that is greatly impacting. As to weekly attendance, we are also not very well aware whether our members are attending, because when you open social media, every church is streaming. So there is a chance that members are fleeting from one church to another. So you do not know whether it's your members who are watching and they are benefiting from you, or they are benefiting from another church. But for that reason, somehow people are benefiting, because there's a lot of messages out there. Another impact is that we are not able to provide care that we are supposed to provide to our members who are sick, who are bereaved. We've resorted to Zoom. Sometimes the family does not get to attend because there are people from the community who sneak to the family and interrupt the services that we try to offer through Zoom. So you are here, you are trying to preach from Zoom. Somebody has already gone to the family and is saying pole in the family, and that way perhaps helping spread the virus. There is a lot of fear. At the beginning, when we were telling people, let's close the churches, or we are closing the churches, we had a lot of criticism. Pastor, you don't have faith. We need to open the churches. But others were also saying, why are you keeping the church open up to today? The conference, in fact, when we met as leaders here and closed our church, the conference said, you cannot close. So we kept it open against the wishes of the team here. So people are afraid now that they know that so and so is sick, so and so is sick. Others are saying, Pastor, we don't want you to reopen the church now because we are not very sure whether people are fully recovered. And so even when we will reopen, we will still continue seeing that slow movement towards the church because of fear. Maybe that is what I can say in regard to the last challenge. Perhaps is creating engaging online content to address all the demographics within the church. That has been a challenge, but so far we are coping the best we can.
Okay, thank you very much. And I think Pastor, I don't know if anybody wanted to comment on top of what Pastor said. You can